Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. The movie's gonna make me a big star.
You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe. Today, we are honored to have Kim with us. Kim is a patient. Kim has been in a car accident. Kim is also in the profession that processes insurance claims that relate to motor vehicle collisions. So she has a perspective of being a patient as well as being in the business and seeing how the whole process of an injury claim happens and what is needed. So thank you for coming over today. But tell us just from a human perspective about your accident, what happened to you? You were in a car and you were hit, correct?
Correct. I was hit from behind.
Very hard?
It was probably going about 10 miles an hour.
Okay.
I felt jostled.
So your body got thrown forward.
Thrown forward.
And sometimes people hit the steering wheel and sometimes people hit the windshield. But as safety of vehicles has improved, we are now more enclosed in the seat. So the seats now have lateral supports to keep the body from shifting. And of course, the chest harness that goes across, so it keeps the torso from going forward. But paradoxically, because the body is strapped in, we're seeing a lot more neck injuries, fewer low back injuries because of the chest harness. So you're hit from behind, you're jostled, your head goes forward a bit, but you don't hit the steering wheel, you don't black out. Next day, you notice something had happened.
Yes, next day. I didn't go to the hospital that first day because I'm going 10 miles an hour,
Right.
Get hit. You think I'm not hurt. You wake up the next morning, you have pain. You don't know where the pain's coming from. It can be stabbing pain. It can be just soreness, but you can wake up and feel different.
So people many times feel dizzy because inside the skull is the brain, and the brain is surrounded by a fluid, but that also allows the brain to bounce around inside the skull, and that bouncing around is thought to sometimes cause people to have dizziness, people to have headaches, people to have numbness or tingling in their face. They can have vision troubles, pain going into the top of the shoulders, into shoulder blades, even shooting all the way down the arm, depending on whether or not they had pre-existing troubles, whether or not they had arthritis before this happened, diabetes, all kinds of things happen. And I know one of the questions that's often asked of me is, how can your patient be injured when there's so little damage, visible damage to the car? And I imagine that's one of the things you deal with, is trying to determine how much the body could be injured based on what is seen on the photographs of the car. If you can tell us a little bit about that, I'd be interested.
Yeah, I mean, I think it's based on delta V, and which is a formula that
Delta V.
V's.
The change in velocity.
That's right. So a lot of it's that. You don't have to. I mean, you can get hurt. You can also get hurt going very slow.
Yes.
And it depends. Obviously, if you have pre-existing conditions, like you said, that can affect your injuries. But it can also, I mean, I want to use the term an eggshell plaintiff.
As we talk about in Texas, the person is an egg, and sometimes those eggs have cracks in them or blemishes in them before the egg is dropped. I'm explaining that to the audience, but go ahead.
Yes. So you can have, but you're injured from the crash, and the crash does cause, to get worse. So even though you may not have known your back you had a disc herniation or whatever, and an accident, bam, makes it worse. Yes, that can affect it too.
And I imagine those are some of the most difficult cases to sort through, because again, the patient really was doing okay, didn't have any pain or didn't have much pain, and then are in an accident that normally wouldn't hurt somebody so much. But if the egg is already cracked and then gets dropped, boom, it becomes a mess.
It does. And then you don't have anything especially if they didn't know they were having issues with, like, say, disc herniation or something else in their back. No pain, nothing, and then no prior imaging. So how are you going to prove?
No MRI before, no MRI an hour after.
Right. And so then you come in, you're hurting. How do you prove that an accident caused those injuries? And again, like I said, you got the eggshell. Maybe it was something before. Maybe there's other issues. Maybe it's diet. Maybe it's something else that could have caused it.
Yes,
I guess there's so many different factors.
there are. There are.
Make it.
And that, so sometimes I'm asked to sort through for both one side or the other, really what happened. And one of the more interesting ones I've had was the big I-30 pileup during the ice storm back 4 or 5 years ago. There were 32 different people injured in multiple vehicles, and trying to sort out what was due to the cars colliding, what was already there, and how can so many people get injured, and how much of this just happened to be, quote, an act of God. Ice sheet gets dropped down on the highway when everybody's driving like they're supposed to. So it gets to be hard to adjudicate. And oftentimes there are no broken bones, so it's not just a simple yes or no. And then, as discussed, pre-existing conditions. But you yourself were on a low velocity injury, and one time one of my patients was involved in a motor vehicle collision, low velocity. They brought in an expert on the shock absorbers that are in the bumpers, and I learned on this, but these shock absorbers can take a lot of shock and then they're permanently damaged. So they absorb the shock, they rupture, which in theory prevents transmission of force into the actual vehicle. But again, if the metal is all the way against the metal, it doesn't really prevent as much as one would think. And those absorbers, while effective, are not totally protective. And again, it doesn't give that much visual, but do you have familiarity with these shock absorber theories?
Yes, yeah, I do. Now, obviously, you're correct. If there was a prior accident and that bumper's already been damaged,
yes,
you have another accident, you can't determine if that, it could be worse on the second accident because you don't have that shock to the cushion, you're saying.
The cushion there. But
yes.
Even on the original accident,
yes, even on the original.
If it goes all the way to the marshmallow absorber between is ruptured, then you do have metal on metal. And as she says, all this comes down to force transmission to the body. And from my perspective, that depends on body position. If you are twisted talking to somebody at the time of impact, that puts a lot more stress on the neck and low back than looking straight ahead. And then also the existence of obesity, diabetes, and other factors, because the tissues just aren't as resilient to taking a shock. So then, as you know, there's all kinds of treatments that can be done, medications, physical therapy, chiropractic therapy, and there's a fair amount of overlap in the state of Texas as to what chiropractors and physical therapists can do. And then medications and injections and even surgery. So that can all take a long time to sort out. Just as a general rule of thumb, I tell my patients not to make any surgical decisions for 6 months, sometimes a year, as long as they're not doing any nerve damage, because body is very good about healing itself, and waiting the 6 months to a year often prevents people from undergoing surgeries that they didn't really have to have.
What do you consider conservative care?
That's a great question, because it's a funny word. If you read the definition of conservative, its primary function is to preserve. So sometimes surgery is the conservative way to go because we're trying to preserve nerve function. We're trying to preserve disc function. And sometimes non-operative treatment is the way to go. So in the medical world, we try not to use the term conservative too much because sometimes it means surgery and sometimes it doesn't. But since it's so commonly used in the lay field, we use it. But to answer your question, that usually means a non-operative therapy. So time, avoiding things that hurt, so bending, lifting, pushing, pulling, twisting, anti-inflammatory medicines such as Advil or Aleve, those are sold over the counter, but then we have more powerful ones, meloxicam and Celebrex being two notable examples. Braces can be a wonderful thing, particularly when it comes to the head, because you can think of the head as a 25-pound bowling ball sitting on a stick, and so it's wobbling. And that wobble on injured discs and injured ligaments can get to be pretty painful. So just sometimes a simple foam brace sold at the various retailers can make a big, big difference. So the resting the neck that way, the anti-inflammatories, avoiding things that hurt, usually does most of it. And then we get into nerve stretching, either in the neck or in the low back by physical therapists, because why you and I can do a good job stretching muscles, we really can't stretch the nerves without stretching the muscles. And there's ways to stretch that purely stretch the nerve or purely stretch the muscle. And again, that's very hard for a layperson to do on their own. And that's why physical therapy can be pretty helpful. The other problem is sometimes just from disease or injury, the bones can be pushed out of alignment. And that's where exercise can be done to stabilize the bones so they aren't shifting out of alignment. And that's probably for the low back, the greatest benefit to therapy. You're watching the C-Spine Show. I'm Dr. Craig Callewart. Please like, follow, and subscribe.
Well, I'll bet you I'm gonna be a big star. Might win an Oscar, you can't never tell. And who's gonna make me a big star? 'Cause I can play the part.